Hello everyone, this is Dr. Abirami, your Physiology faculty. I welcome you all to the discussion of Rajasthan MO paper 2024. Let's start off with the first question. The question was about herring-brewer reflexes. The herring-brewer reflexes are mediated by slowly adapting myelinated fibers, the vagal fibers, unmyelinated pulmonary C fibers, unmyelinated bronchial C fibers, rapidly adapting myelinated vagal fibers. Let's have a discussion on this and we'll come back to the question. The bronchopulmonary reflexes. Essentially, all bronchopulmonary reflexes that modify the depth and duration of inspiration and expiration are mediated through vagus. Vagus nerve is the important nerve. The vagus nerve has both myelinated and unmyelinated fibers. The myelinated vagal afferent fibers are activated through slowly adapting stretch receptors and rapidly adapting receptors. The slowly adapting receptors, which are activated by volume and stretching of the lung, thereby mediating herring-brewer reflexes. So, slowly adapting vagal fibers, slowly adapting myelinated vagal fibers are responsible for sensing the volume and stretch of the lung, thereby helping in herring-brewer reflexes. What is the role of rapidly adapting receptors, which are activated in response to inhaled irritants like ammonia or cigarette smoke and large inflations or deflations of the lung? So, slowly adapting vagus myelinated fibers responsible for herring-brewer reflexes and rapidly adapting vagal myelinated fibers, they respond to inhaled irritants. The activation of slowly adapting receptors changes the duration of inspiration and expiration, whereas activation of rapidly adapting receptor causes reflexes such as cough. Then, what is the role of unmyelinated vagal afferents, specifically the C fibers in the airway? They are activated by a multitude of chemical stimuli, including carbon dioxide and capsaicin, in addition also to lung edema and elevated temperatures. Thereby, the activation of C fibers in the lung causes rapid, shallow breathing and apnea. So, to summarize this, the vagus myelinated fibers, slow adapting fibers responsible for herring-brewer reflex, rapidly adapting fibers responsible for responding to inhaled irritants, thereby they are helpful in cough reflexes. Unmyelinated vagal afferents, they are activated by carbon dioxide and capsaicin and also by lung edema and elevated temperatures, and they cause shallow breathing and apnea. So, moving back to the question, herring-brewer reflexes are mediated by slowly adapting myelinated vagal fibers. Slowly adapting myelinated vagal fibers. Over to question number 2. Warfarin anticoagulant inhibits the following. What is warfarin? Warfarin is a oral anticoagulant. The mechanism of action. Before we move on to the mechanism of action of warfarin, let's discuss the natural anti-clotting mechanisms inside the body. Blood does not clot inside your blood vessels because a normal, healthy, smooth endothelium will not provide a smooth surface for platelet adhesion. Only if your blood vessels are damaged, platelets can adhere. Otherwise, platelets, they flow freely. They don't attach to the blood vessel wall. The glycocalyx on the endothelial surface is a repellent for platelets and clotting factors. Antithrombin 3. Naturally, blood has antithrombin 3, and this antithrombin 3 can inactivate clotting factors 9, 10, 11, and 12. Prostacyclins of the endothelium. In a natural, healthy endothelium, it has prostacyclins which can antagonize the action of thromboxane A2, and thromboxane A2 helps in platelet aggregation. Even if by mistake a clot is formed, your body itself can lyse the clot by the natural fibrinolytic system. These are the natural anti-clotting mechanisms. Based on this, we have developed anti-clotting drugs. What are the anti-clotting drugs? Heparin. What is the mechanism of action of heparin? Heparin facilitates antithrombin 3, thereby becoming an injectable anticoagulant. Calcium chelating agents like oxalates. If you chelate calcium, if you neutralize calcium, calcium is an important clotting factor. If calcium is not there, clot cannot be formed. And they are especially used in blood banks, labs, blood bags where you want to store blood. Coumarin derivatives. Dicomarol and warfarin, they are mainly oral anticoagulants. They inhibit vitamin K. And vitamin K in turn is responsible for clotting factors 2, 7, 9, 10. And that's why clotting factors 2, 7, 9, 10 are called as vitamin K dependent clotting factors. So dicomarol and warfarin, by inhibiting vitamin K, they inhibit clotting factors 2, 7, 9 and 10. Moving back to the question, warfarin anticoagulant inhibits factors 2, 7, 9 and 10. Over to third question. When the oxygen hemoglobin dissociation curve shifts to the right, it is associated with. So the question is about the right shift of this curve. This is called oxyhemoglobin dissociation curve with partial pressure of oxygen in millimeter of mercury on x-axis and hemoglobin saturation in percentage on y-axis. And the curve that I'm tracing now in red, this is the normal curve. The red curve is the normal curve. And normally you see that the P50 value, what is P50 value? The partial pressure at which there is 50% saturation. This is called P50 value. The normal P50 value is 27 millimeter of mercury, as you can see in this diagram. What happens to this P50 value in right shift of the curve? If this curve shifts to the right like this, I'll just mark the P50 for the green curve. Green curve is the right shift curve. So the P50 value has gone here. Normally it was 27 millimeter of mercury. When the curve has gone to the right side, the P50 value also has gone to the right side. The value has increased. So in right shift of the curve, P50 value would increase. What would happen in left shift of the curve? P50 value would decrease. So in right shift, P50 value increases and left shift P50 value decreases. So in this question, when oxyhemoglobin dissociation curve shifts to the right, it is associated with increased P50. What about the other options? Increased affinity of hemoglobin for oxygen? No, because in right shift of the curve, the oxygen hemoglobin affinity decreases. In right shift, there is decreased oxygen hemoglobin affinity. It means if this is hemoglobin, this is oxygen. Oxygen is removed from hemoglobin and it is given to the tissues. So there is unloading of oxygen from hemoglobin. Oxygen is unloaded and given to the tissues. So in right shift of the curve, there is decreased oxygen affinity and increased oxygen unloading. So increased oxygen affinity is wrong. Impaired ability to unload. So this is also wrong. There is increased ability to unload oxygen in the tissues. Increased oxygen carrying capacity of hemoglobin. This is also wrong because oxygen hemoglobin affinity decreases. There is decreased oxygen carrying capacity for hemoglobin. So the right answer for this is option C, increased P50 value. Over to question number 4. In ECF, extracellular fluid, the main electrolyte is, so the question is about the composition of ECF. If this is extracellular fluid and this is intracellular fluid, the major cation in ECF is Na plus, sodium. The major cation in ICF, inside the cells, potassium followed by magnesium. Potassium followed by magnesium. The major anion in ECF is chloride. The major anion in ICF is proteins and phosphates. Proteins and phosphates. So what is the right answer for this question? So the question is about in ECF, extracellular fluid, the major electrolyte is, yes, obviously sodium. Yes, that was a quick discussion of the Rajasthan MO paper of 2024. Hope it was a useful session. Thank you so much for joining with us for the session. And please remember, don't settle, don't stop. Good luck, guys. Thank you.